Any artificial intelligence. You've probably asked ChatGPT or some AI system a health question or two. But is that virtual assistant giving you good advice is the question. We've got Dr. Aimee Duffy here from Carolina Integrative Medicine. And you say AI is like the WebMD on steroids these days.
Yeah.
What's happening?
I mean, it's fantastic. People are using AI for everything, right? And it can be really helpful for health things. But you have to sort of think twice, right? Like if you go to the doctor and you have a rash, you know, we're going to ask you lots of different questions. When did it start? Where is it? How does it feel? Is it painful, itchy? What does it look like? And if you use chat and it's not asking you those clarifying questions, it's going to go right to a solution that may not be the right one.
And to kind of highlight this, you devised a game to see if we can spot good advice from bad. So how's the game work?
Well, I'm gonna actually tell you a question that I put into AI about some health issue, right? Okay. And then we're going to say, you know, red, yellow, or green. So green is like, yeah, that sounds like great advice. I would use that. Good advice. Yellow is like, maybe we should ask a couple questions or verify. And then red is sort of, ooh, that sounds dangerous. Right. Let's move on from there, right?
Let's go. What's the first question?
Okay, so the first question is about fatigue. So I'm exhausted all the time, even though I feel like I get enough sleep. Is there something wrong with me? So the AI answer is this could be your thyroid, anemia, vitamin deficiency, maybe you have sleep apnea. Well, anemia is common in women, so why don't you try taking iron, 65 milligrams a day. Make sure you add some vitamin C for absorption.
All right, so he's giving advice. AI is telling this patient what to take without knowing what the patient's history is.
Exactly, right? So you could have iron deficiency, but we don't know, right? We haven't done any testing. We didn't ask any more specific questions, so we really have to dig a little bit deeper there.
Okay, so dig deeper on that one. Another question you've asked is, well, yeah, what's your next?
So the next one is an injury, right? So I twisted my ankle playing tennis. What should I do? And so AI says, oh, you should take ibuprofen, 600 milligrams, ice it for 48 hours, and elevate. Kind of the rice thing that we've heard about injury before, right? So
that seems okay to me, but this yellow paddle goes up nicely.
It's a little scary, right? So again, no clarifying questions. We know nothing about your medical history. Is ibuprofen safe for you? Are you on blood thinners? Do you have ulcers? Do you have a kidney problem? Because ibuprofen can affect your kidneys, right? So, and we don't know if that injury is something you shouldn't need evaluated a little bit deeper. Yeah. Is it fractured?
So you really have to consider that it could be dangerous depending on your medical history. AI is not going to know you as a patient.
Right.
One more question has to do with nutrition. The doctor recommends eating a certain amount of protein.
Yep. So my doctor said I should try eating 100 milligrams of protein a day. So can you give me some high protein meal ideas? And so AI does its magic there, right?
Meal ideas, this sounds like a good thing to be asking.
Absolutely. So when we know specifically what we're looking for, then AI is going to be able to generate, you know, not only eat this, but why are we eating it? How many milligrams or grams of protein does it have? And it can add it all up. And like, this is really where it does its magic. And it can even take it so far to be convenient by giving you a grocery list and all that kind of stuff. So this is where AI shines.
So this is where AI is its best. You can ask, you have to have the information that you need to know about yourself, and then you can ask recipes, you can ask nutrition questions.
Yeah. And what I love about this is, like, if you do have that fatigue question, right, like you can ask, and one of the things we're learning about AI in any business is to say, when you ask the question, say, ask me some clarifying questions or something like that, so you can kind of dig deep. Then take that answer to your doctor's appointment to say, hey, you know, I have some ideas, and then that makes our conversation a little bit easier to kind of come up with. We've already gone through some of those questions that we would have otherwise done at the office.
Perfect. So you actually do like it when somebody brings their research. You're not saying don't do the research. You're saying bring it to the doctor. But some final advice on using AI safely. You know, don't use it for symptoms that scare you, right? If something comes on
if you have
quickly,
severe headache, you have chest pain, you know, you can say, should I call 911 for this? And hopefully it gives you the right answer. But, you know, when it comes to something that's really significant or something that's scary, you need to pick up the phone, not pick up your, well, I guess you're picking up your phone, but call somebody instead of just typing in a question there for sure.
Okay, very good. Any other tips we should keep in mind overall, you know, as we use this resource in a smart way?
I mean, again, just think about, you know, does this sound like it's sound advice or not for something like that? So be more specific. Tell it to ask you some clarifying questions, bring those questions to your doctor, and use it where it shines is giving you some advice, like about meal planning, you know, saving time, that sort of thing. That's where it's going to be most helpful.
And this is something that's been on your radar lately, because what you're seeing it with your patients. AI told me this, AI told me that.
And it's scary, you know, we don't want AI to replace your doctor, you know, and there are proper ways to use AI in medicine, just like there are proper ways to use AI in anything. So just be aware.
A good tool, but not to replace medical care. Dr. Aimee Duffy, thank you very much.
Yeah.
Learn more about Dr. Duffy's integrative approach to your health. You can find her at Carolina Integrative Medicine in Clemson.